my experience on placement in Geraldton, Western Australia with WACRA. And I'd like to talk about three parts of that placement that were really, really changed the way I then have gone on to continue on with my master's. So the first experience was the moving orientation, the cultural orientation that's offered to everyone, all the students and I assume other staff at WACRA. So that was really amazing because we actually drove around Geraldton and got to hear some really powerful stories that were really specific to the community that I would be, learning and working in. And that experience really helped me understand the cultural norms specific to the Geraldton region, which was really important. I also got the opportunity to do clinical yarning. So I really took from that, it's very different to the kind of dietetics, a diemy, really kind of A, B, C, D stuff. It really encouraged me to sort of have a more circular approach when working with Aboriginal and Torres Strait Islander people in that whole assessment part of dietetics. So some really big lessons I took from that experience was finding the common ground with whoever I was working with, really engaging deep listening, and listening not just, with my ears, but everything. And then also using storytelling as a medium for sharing health messaging. But they were the real sort of standout messages from that cultural yarning experience. And then I also had the opportunity to participate in a workshop called Start the Dream. And that is after school workshops for children in Geraldton, and it's a multidisciplinary, run by multidisciplinary teams. And so it's after school and the kids do different sporting activities, and then you actually do cooking and share like a bit of an afternoon tea with them. And that was such an amazing experience because I'd sort of come in never being to Geraldton, doing the clinical yarning and the cultural orientation, and then going on to sort of participate in the Start the Dream. I really felt quite well prepared to go and do that because it can be really confronting. Some of the children had really rough home lives and sort of were really impacted by the intergenerational trauma. So I think without having the cultural orientation, the clinical yarning, it would have been far more confronting, and I wouldn't have been as well equipped to sort of naturally manage that sort of environment. I think those three experiences too are really invaluable to the project work that I was doing. I was working on a consumer engagement project for the Grams Paediatric Service and just trying to make some recommendations about where they could improve that service to get better consumer engagement. And I feel that those experiences of cultural orientation, clinical yarning, Start the Dream, and the other experiences that I had, but I'll keep it short for today, really helped give my recommendations that I was making about the consumer engagement relevancy. And I think that if I didn't have those experiences, I wouldn't have had, the depth in my recommendations that I felt that I did. And I think generally as a whole, my time at WACRA was hands down my favourite non-clinical placement by far. It was one of those experiences where on the East Coast, I don't think an organisation like WACRA exists. All that accommodation was included. My supervisor, Meredith, was incredible. And the organisation, doesn't matter who it is, it could be a groundskeeper, a receptionist, anybody, was just so supportive of the student. So I felt so welcome. I never felt out of my depth. Everybody checked on how you were doing. And I've always had really excellent supervisors and great work placements, but it was really standout. I felt very, very well cared for, and that really helped me feel comfortable really immersing myself in the whole WACRA experience. Thank you.